Febrile convulsion typically is found in the 6 months to 6 years old child. Tonic-clonic type of convulsion and usually occurs in one episode in a day. It there remains a cause of fever, usually upper respiratory infection, maybe lower respiratory, maybe UTI, maybe other cause. So, and the fever usually slow grade, maybe a variable grade. It lasts less than convulsion lasts less than 5 minutes, and family history in either parents is found in 30% of cases. Typical convulsion child has postictal sleep, and then otherwise after examination, after convulsion, the child is perfectly all right. He doesn't have any features of the meningitis. He doesn't have any features of the chronic neurological deficit. And but in some atypical cases, you are really confused when the child is of less than 6 months old or more than 6 years old, multiple fits in a day, and convulsion lasts more than 5 minutes. And typical non-tonic clonic and and some other neurological deficit association. In those cases, clinician is really is in trouble to diagnose febrile convulsion. So follow this child, and the long-term follow-up. 30% of these children has idiopathic epilepsy. How to treat this febrile convulsion? Fever should be treated with paracetamol. Typical standard dose 60 mg per kg per day in 4 or 3 divided doses. Parenteral diazepam 0.3 mg per kg per day, or intranasal midazolam 0.2 mg per kg per dose, and your treatment of infection. But this child needs to be addressed in different way. We should be sure that we are not missing meningitis, encephalitis, and some other grave illnesses, or the very severe or the difficult diagnosis like the typical your hyponatremia by other grave illness. So, and then the best way is to assess this part is to see the child after convulsion is over, whether he is playing, he is standing, he is walking, and is feeding. Everything is normal. There's no signs of neck rigidity like cardiac arrest, meningitis, no, nothing. So, in those cases of febrile convulsion, go on following up this child, give diazepam, and if any confusion at in diagnosis during the attack, and subsequently you admit the child and observe these signs and do investigate if you feel like. But ultimately, in long-term follow-up, these children has happy outcome. Association of the underlying neurological disease may need to be addressed if they are really found.